Welcome to the weekly checkup on ReachMD for the week of November 23rd, 2015. This week's news segment examines a surprising link between a sense of smell and early signs of dementia. According to a recent study from the Journal of the American Medical Association, a loss of smell in the elderly could correlate with the progression of Alzheimer's disease and mild cognitive impairment. Researchers believe that the region of the brain which support olfactory function are the same as those related to memory and language. This understanding may pave the way for non-invasive screening tests for diminishing sense of smell, with hopes of earlier detection for Alzheimer's disease. ReachMD continues this month's focus on diabetes with a glimpse into health reform that encourages patients to use preventative screening. Find out where healthcare spending is truly going in the segment, The Cost of Diabetes to the Healthcare System. Hear about the origins of high hospital costs and the surprising toll that chronic conditions put on the system. And now for a quick look at some of our latest featured content. Twirl into the new Everyday Family Medicine segment titled Caring for Dancers, the nuances of performing arts medicine. Highly demanding and lengthy training sessions put a strain on dancers' bodies. Learn how to treat these aspiring and professional patients on physical, social, and emotional levels. For this week's video highlight, I smell another curious headlines with Dr. Matt Bernholtz on its way.
Peanut butter. It's crunchy, it's creamy, it's delicious. If you don't like it, you might not be American. And if you can't smell it, you might have Alzheimer's? Turns out that might actually be true to some extent. Research published in the Journal of Neurological Sciences is touting a peanut butter smell test, which proposes to help detect early Alzheimer's disease. It's based on a study finding that patients with early-stage Alzheimer's exhibit a significant impairment in their sense of smell, specifically from the left side. This unilateral loss of smell may be attributed to the pattern of brain shrinkage seen in Alzheimer's, often beginning, of course, at the left temporal lobe. Ergo, peanut butter smell test, which came about when researchers compared sense of smell in Alzheimer's patients versus healthy adults. They found that Alzheimer's patients needed to be 10 centimeters closer than healthy counterparts just to identify the smell of peanut butter from the left side. So what does this mean for practice standards? Well, in a large hospital with access to PET scanners and spinal taps, probably not too much. But elsewhere, maybe something to consider trying out. And if you're asking yourself, why peanut butter and not something like, say, anchovies or cave-aged cheese of some kind? Well, let me just remind you that this is America. We'll use peanut butter, thank you very much. Smells like memory. To your mental health, America. I'm Dr. Matt Bernholtz.
For more featured content, head to ReachMD.com or listen in on iHeartRadio or TuneIn. For those of you in the New York area, be sure to mark your calendars for the weekend of December 4th and 5th. Omnia Education's Women's Health Annual Visit and Stages in Women's Health conferences are coming to the New York Marriott Marquis for a 2-day healthcare education extravaganza. Come visit the ReachMD booth on site to learn more about our available programs and maybe even join us on air. For all of us here at ReachMD, I'm Sherry Neely, inviting you to be part of the knowledge.